Well, Nana Addo Ekufuado has been in the why am I continuously saying Eastern region, like Central region? And Richard Kojanyako, who is our colleague, joins us via Skype this morning to give us an update. Soon to be lawyer Kojanyako, good morning.
Good morning, Mama V.
Yeah, I hope you're well. This your tie,
yes.
Like what's up? What's up?
Yeah.
I'm doing well.
Cool. So tell us what the flag bearer of the NPP has been up to in the Central region. Where exactly has it been?
Well, the flag bearer of the NPP started the 3-day tour in the Gomoa East constituency of the Central region. From the Gomoa East, he went to the Ekumfi constituency. From the Ekumfi constituency, he went to the Isikuma Odobin Brakwa constituency. And yesterday, we were at the Upper Dinchra West and Upper Dinchra East constituency. And today, we are starting off at the Asan Central, Asan South constituency, because yesterday, late in the night, we did Asan North. And after these places, we'll go to the KEA constituency, the commander, Edna Egwafu Ebrim constituency, and he will be interacting with some fisher folks there. And in the evening, around 6 p.m., Nanado will be addressing the staff and students of the University of Cape Coast. So these are the things that, these are the places that Nanado, the flag bearer, has been going with his entourage.
Richard, we know he was in the hometown of the late president, John Evans Atamils. And I hear the reception was great. What more can you say about that? How was the reception, and what exactly did the chiefs and the people share with him there?
The reception was great. The fact that the chiefs met him, they were very happy. They enumerated their challenges. The fact that they told him that the Mahama administration came to lie to them. There are so many unfulfilled promises. They told them that we're going to construct their roads, and 4 years down the line, their roads are still in a deplorable state. They told them that we're going to fix their water system so that they will get potable drinking water, and it hasn't happened. They also told them that we're going to fix some of the broken down social amenities that they used to enjoy, but still they are unfixed. They mentioned the National Health Insurance scheme. They also mentioned the school feeding program, because, you know, it is in a rural community, and a rural community such as Ekumfi Otuam, they enjoy the school feeding program, and they say that the school feeding program is in shambles. It has almost collapsed, and so they think that it is time for change. But Nanado, in response, told them that, yes, he knows very well, he knows the late Atamos very well. They were schoolmates back at the University of Ghana. They used to play football together. They shared a lot of things, and he even came to contest the late president, which he lost. He admitted, and so Nanado asked them to observe a minute silence for the late president, and said that this is the opportune time for them to change their heart and minds towards the NDC and then revert to the MPP, because the MPP has good policies. They will put in place the $1 million, one constituency, the one district, one factory policy, and all of that one. So Nanado was very happy with the reception, the fact that the chiefs voluntarily came to tell them that, yes, we have a change of mind, and we are going to vote for the MPP. And you know, Nanado is also being accompanied by other bigwigs of the NPP, notably among these people, Dr. Kofi Kunedu-Apreku. You know, he is a former Minister of State, and Alan Kojo Chiramanting. And one of the things that Dr. Kofi Kunedu-Apreku told the people of Ekumfi is to ignore the smaller parties that are also competing in the 2016 polls. According to him, the smaller parties would not win because they do not have the capacity and might the NDC and the MPP have, such that they could win the 2016 elections. And so they should all channel their votes into voting for the MPP, because they have the capacity and they can win. He did not also say that, well, the smaller parties are not important. He says that, yes, they helped them secure victory in the 2000 and 2004 elections. But this time around, it is a crucial election such that they need to give them a one-touch victory. And so they are not in for a second round or a first round victory, but they want a one-touch victory so that Nanado will assume the reins of power.
Okay. So, Kojo, what's the plan ahead? What's happening later today?
Well, later today Nanado is currently interacting with the chiefs in the Asin Central and the Asin North constituency. From here, he will proceed to organize some mini rallies. He will be addressing them. You know, the Asin Central and the Asin South constituencies have consistently been with the NPP. You talk about Professor Dominic Phoebe. He's been their member of parliament for a long time. This time he's not contesting again. There is a new face. You talk about Kennedy Japan. Kennedy Japan became a member of parliament for the place in 2000. And so he's been there for 4 consecutive times, and the people have voted. Their pattern hasn't changed, and their pattern has consistently been with the NPP. And so Nanado is looking ahead to consolidate the votes and the margin that they give the NDC in these 2 constituencies. He also be interacting with the market women and taxi drivers in these 2 constituencies. From here, you know, fishing is one of the things that come to mind as far as securing a lot of votes along the coastal belt of the central region. And so you go to Elmina, where there will be a gathering of the chiefs and people of these places. You know, when you talk about fishing in the central region, you talk about Elmina, you talk about Cape Coast, you talk about Apam. And so he will be listening to the concerns of these fishermen, and he will be seeking to address them, and he will be telling them the policy of the NPP when they come to power as far as the fishing industry is concerned. Later in the evening, just as I told you, he will be giving a lecture on the economy, education, and a lot more to the people, to the students and the lecturers of this university. They call it the University of Competitive Choice, Mama V.
University of what?
Competitive Choice. UCC.
Okay, we'll leave you to have a competitive day today. But when is he wrapping up, you know, the whole activities in the central region?
Today, after the lecture, then the tour would end. He will proceed to the western region to start another campaign tour of the western region. So Nanado is ending the tour of the central region today.
All right, Richard Kwadwo, we'll leave you to still follow through with the campaigns, even though you have a lecture as well. Manage the 2. Thanks for joining us. Have a good day,
Enjoy your day.
Enjoy yours too.
All right, that's our colleague in the Central Region, Richard Kwadwo.
Interesting.
Okay, so, you know, this conversation that we've been hammering on, but do you have any comments related to?
Yeah, there are a lot of comments. This is Francis from Commenda, sending us this message from the Central Region. Why are we doing this to ourselves, he asked. We see the devil, and the devil is in our own sleeves. And he's saying that Ghanaians need to help move the country forward. And, well, he says we also need to change our attitudes. Interesting. And you know, people are actually still sending the selfie thing. And this one says, Mama Vivi, Accra Psychiatric Hospital is a shame to the country. The government is to blame for the total total neglect of the facility. The Minister of Health must bury his head in shame. And you're also saying he should resign. Nana Kwesi in Techiman sending us this message. And Akwesi from Seshi says, the government is still owing nurses over 15 months arrears. And he's saying that God is there. God is there. And someone, well, there's a lot. Please keep your messages short and simple. It's quite difficult to go through a very lengthy message and summarize. And, well, this one says, the truth is that the Accra Psychiatric Hospital is not in good condition. What the government says, they know, they admit. And even Tony Goodman, who is the PRO of the Ministry of Health, just said that what he witnessed there is not something that anybody should see. And says, you're asking the government to start renovating the whole structure. It's not about drugs. What's the use if you give patients drugs and there is no bed for them to sleep on? These medications they take make them sleep, and even the mattresses are not there for them to sleep. You say you've been there before with a family member. The environment is not good. The workers there are suffering. Mercy in Kumasi is sending us this message. This one says, I prefer to live in a world in which man has the right to make choices rather than a world in which no chances at all is left to you. Let's make our choices in a peaceful manner come December 7th. Sylvester in Mampong sending us this message. You also sent us a selfie of yourself. Thank you so much. It seems that it's catching on well with you. This one says, please pay attention to biomedical scientists. The media, you think, is not focusing on the strike embarked on by biomedical scientists. Kwao in Aflao sending us that particular message. This one says, you think that Nana Addo will be president come election 2016. This is from Benson. Yeah, Mama V.
All right, so thanks for sending those messages. You too can send your comment on 0560 800,000. We've got some 5 more minutes to hit 8. When we come back, we're having this conversation. So apparently, there's a strong correlation between rule-breaking youngsters and high-income midlife. Accordingly, such children, they say, might be more competitive in the classroom, leading to better grades. They might be more demanding as adults when locked in salary negotiations. They may be the ones who demand more. They may be more willing to fight for their own financial interests, even at the risk of annoying friends and colleagues. But how do you know if your child is strong-willed? And is that even good? If you've got a difficult child, how do you handle them? How do you even convince yourself through this research that
it's going to be well?
Yeah, it's going to be well when they're adults. It doesn't always turn out right. This research might lead us somewhere, but we know that it doesn't always happen that way. So how do you manage it?
Yes, and I think there are some exclusive cases, and really every case is different in itself. So like you're saying, how do you manage it?
Yeah.
I think that some parents are able to handle it well, others are not able to handle it well. So I think it's not exclusive to that character trait, but the other factors that, you know, help that trait develop. So
I agree.
Yes,
I agree. Because you may rely on this research and say, oh, they turn out better, so, you know, I'll just give up. And then you may just give up on the child and the child's future as well. We've got somebody who is really difficult.
I like the way you roll up your eyes. Really difficult.
And I'm sure
really difficult.
His mother sees him today and says, hey, hey. I go be kaya. So it's like testimony time here on the show today. We want to give you some real hope with your children this morning on the AM show. So stay with us. We'll come back with more.